Hey everybody, Mayor Alan Weber here from City Hall, wearing my face mask because we got to stay vigilant. There's a lot of good news, and Dr. Wendy Johnson is here to talk about it. I want to kick it off with a report from the drive-through vaccination event at the Midtown campus. I was over there this morning with Lillian Montoya from Christus St. Vincent. They are going to vaccinate, we are going to vaccinate 2,000 Santa Feans today. And there will be four more of those events. You must sign up. You must register at DOH. I can tell you the spirit over there was phenomenal. There was music in the air. Que Suave was playing great hits. And meanwhile, the city police and fire and traffic folks were keeping people moving smoothly. The Midtown campus was operating as a temporary clinic. We had support from the National Guard. It was a community event that only Santa Fe could do. It was beautiful, and the spirit was fantastic. People were so happy. They didn't have to get out of their cars. You could have a driver and a passenger both get vaccinated and then wait in a little area for about 15 minutes to make sure you didn't have any negative after effects. I was there and already more than 800 people this morning had been vaccinated with a 2,000 estimate for the rest of the day. So please, you must be registered with the DOH. The current data for Santa Fe County, almost 52% have had one dose. Fully vaccinated, 37%, and registered, 67%. So 2/3 of us are now registered. We got to get that other third registered so you can get vaccinated. Do it for your family and your friends. You may say, oh, I'm not going to get sick. I don't need it. Fine. Your family, your grandma, your grandpa, get vaccinated. Everybody 16 and over, the the good news is the dam is burst. The vaccine is coming. The distribution is available. Do it, but don't let down your guard. Continue to wear a face mask. Be safe when you go out. And Dr. Wendy Johnson is going to tell us why, because it has to do with variants. Right, Dr.
Yeah,
Johnson?
absolutely. So the situation we're in right now is that New Mexico, relative to the rest of the country, we're in a pretty good spot. And the reason we're in that good spot is because in almost all the states, a lot of the state turned turquoise the other day on Wednesday. So more and more is opening, and we're able to open because we have very little transmission of the virus. And so the numbers are going down, the numbers of new cases are going down, the hospitalizations, the deaths are all going down. Great news for New Mexico. We also have another advantageous fact about New Mexico, which is that so far we haven't seen much in the way of the variants here. So I think there's been like under 40 cases detected in the state of the B117 variant, which is a good number, a low number. We're one of the lower states in the country for that variant. The bad news is that variant, that's what sometimes is called the UK variant, which is more contagious and also more deadly, really, we're finding out. That variant is now the majority variant in the United States. Didn't take long for it to take over as the main variant, the main type of COVID virus that we have. So the other thing is new variants are continuing to crop up. And there's a new concerning variant in that's just cropped up in San Francisco that might be from India, I think. So given all that, it's so critical to get vaccinated because the way that new variants can come up is when there's lots of transmission. And even if they don't, even if we take care of New Mexico, which is all we really can control here, a new variant could come in from outside the state and we could be back at square one. And it is, if new variants come very quickly because there's surges even in other countries or other states, it takes a while to test the new variants. It takes a while to know whether the new variants are going to be, prevented by the vaccine. So it is really a race against time. Even though some of the new variants might not be as, the vaccine might not be as effective against some of the new variants, if we can all get vaccinated or get to that point of herd immunity, we can basically stop the transmission. And when the virus jumps from person to person, that's when the mutations happen. Okay, so if we can prevent the virus from jumping to person, we can prevent the variants. And really, we're doing a great job in New Mexico. But at the clinic, where at La Familia, where I work, we are starting to see now we've gotten that big wave of people that really want the vaccine. And I'm starting to, when I go into my office visits with patients or call them on the phone, first thing I'm asking is, I see you haven't been vaccinated. Do you want the vaccine? We're signing up patients for it. Are you signed up with the Department of Health? And more people are saying, I don't know. And then I have to spend time talking to them and explaining how important it is, because most of the people who really want it now have already gotten it. So I need everyone to really, if you have questions, talk to your primary care doctor, talk to somebody you trust in the medical system. And we really need to get everybody signed up. And if you have questions or hesitancy about the vaccine, talk to somebody you trust about it. And hopefully they will tell you. What I would tell you is that it's one of the safest vaccines out there. Much better, you might get some side effects the first couple of days after getting it, but that's your immune system working. And certainly that's a much better situation to be in than to have severe COVID. Now we're finding out about a third of the people with severe COVID have long-term effects, either long-term fatigue, psychological or cognitive effects, neurological effects, breathing issues that go longer than 6 months, a third of the people. That's a lot. So even if you don't get severe COVID, even if you don't end up in a hospital or on a ventilator, you can still end up with this chronic disease. And we don't know how long chronic is right now. So don't risk it, get the vaccine.
And let's talk about young people. If you're 16 and over, you're eligible, right?
That's right. And that's another thing. In the next couple of months, I think we're going to see both Pfizer and Moderna opening up to even younger, maybe down to 12 is what I hear. So, and this B117 variant is also spreads faster in younger people and is more serious and potentially even deadly in younger people. So again, as we roll out more vaccines, different types of vaccines and vaccines for younger people, please get in line as you become eligible.
And to be eligible, you got to get into the DOH website and register, whether you're 16, 17, or 75. So register,
Right.
register.
Right. And right now, only 16 and older can register, but stay tuned because I think in the coming weeks, probably less than 2 months from now, we'll be getting an emergency use authorization for the Pfizer and Moderna vaccine for younger people. So stay tuned.
How are we doing with vaccine equity? It's a big deal. We need to make sure that everybody gets a fair shot at a fair shot. How are we doing?
Well, quite frankly, we're not doing that well in the state. The majority, I can't remember the numbers off the top of my head, but I think it's something like 70 or 80% of white folks who live in New Mexico are registered in the DOH, and it's much lower, like under 50% of the Hispanic population. And so, for example, there are, of course, kind of technology barrier issues and that kind of thing. So if you are not able to register on a computer, if you don't have a smartphone, call that Department of Health phone number or get a friend or a relative or somebody that does have access to technology to help you with that. But you can call the Department of Health phone number and they will sign you up. You don't have to have a computer to sign up on the Department of Health website. And also talk to your primary care doctor, because I think in coming weeks, more and more primary care docs are going to have access to the vaccine. And the third thing, if you live in Santa Fe, call Christus, because right now, I don't know if my information is totally up to date, and maybe from having gone to the vaccine event, Mayor, but I think Christus is handling people, whether or not a Christus patient, who are over 60 or who are over 50 with chronic illness. And if you're not signed up to the Department of Health website, call them and they will take care of that as well. So if you're in one of those categories, for sure.
Great. And if you need help getting signed up, call the city, talk to our senior services folks. If you're an older person, the The Fiesta Council's been doing a great job of outreach to seniors. There's a lot of help out there if you need it. So don't let a lack of technology stand between you and a vaccination. We also have talked in the past, Doctor, about mental health. The fact that this is a stress. It's been a year of stress. It's been a year of pressure and worry and concern and loss. And what do folks do if they're feeling like they just need somebody to talk to about their mental health? Because physical health, yep, we got vaccines, but for mental health, we need people to talk to and give us some guidance. Is there a very simple phone number or crisis line you can offer?
Yeah, there is the New Mexico crisis line for anyone having any kind of emotional crisis or mental health or substance use issue or crisis is 1-855-NM-CRISIS. So that's 1-855-662-7474. You know, if you're really in severe crisis, if you're contemplating hurting yourself or others, you can also call 911 also. So, you know, don't hesitate to call those numbers if you need to reach out to someone. It's a really hard time for people. You know, there's the stimulus checks, there's some advantages, but a lot of people have been out of work for a long time. A lot of people are facing the end of like our eviction moratoriums and things like that, and really don't know what they're going to do. They're afraid of being homeless. They have no income. There's no cushion anymore. You know, the stimulus, frankly, wasn't really enough, even though, you know, we got some extra here in New Mexico, but it wasn't really enough for a lot of my patients are really in dire straits. So reach out. The other great resource is the Santa Fe Connect folks for resources like food or transportation or connecting to healthcare. But for mental health issues, that 1-855-NM-CRISIS is a great place to start.
And keep wearing your mask. We have Operation Face Mask going on. The city government has free face masks. We're distributing them at rec centers, tourism offices, libraries. They're reusable. They're cotton masks. Don't stop wearing your mask. It is not, we're not out of this yet. We're doing real well. I think compared to most places in the around the world, Santa Fe County is setting a very outstanding standard. The numbers, I think yesterday we had 9 new cases, 6 before that, 6 before that, 3 before that. That's a sign that people are really being very respectful of each other and safe with their practices. But don't assume that we're out of the woods yet. We want to be cautious and optimistic at the same time. So wash your hands, use hand sanitizer. The things we've been saying for a year, keep doing them.
Yeah.
And then get vaccinated.
Yeah, I was going to say, especially if you're unvaccinated, you know, really it's dangerous if you're unvaccinated to go out in public, especially inside. So it's interesting about our mask mandate. You know, I had a friend visiting from out of town and she didn't realize that that we have a mask mandate and that it's even outside and even if you're far away from other people. So she was walking near the plaza and she commented to me, oh, this person told me to put my mask on. And I was like 20 feet away from them. I'm like, well, it's kind of the law here. So yeah, they were right. She's like, really? So educate your folks if you have folks visiting, or even if you see somebody, you know, you can this person, what she said, this person was polite, you know, and would you please put your mask on? It's a law here in Santa Fe, you know, and I think most people take that well.
I think folks realize that we may be wearing masks for a long time. They do in Asia. Actually, Doctor, last question. We've had some really unanticipated, interesting offshoots from wearing masks. Our cold season is less. Our flu season is less. There's some behavioral changes that we might continue in the future just because other people do it in Asia. You go to Japan or other Asian nations and people wear masks all the time. They're not really self-conscious about it. It's just daily life. I think it's helped us reduce COVID spread, but it may also have had some other benefits, keeping the flu season down, reducing maybe other allergy reactions. Who knows? But it's not weird anymore. It is just how we live.
Yeah, in fact, it feels weird to not have a mask on. You know, I've gone out to eat a couple of times and, you know, if you're sitting, even with other vaccinated people, indoors. CDC that says that's okay, but you feel like, ooh, being a little naughty. It feels a little weird not to have a mask on. But I'll tell you one thing about Santa Fe and about the unintended effects. If you have kids, you probably know what RSV is, which is a pretty severe respiratory infection that little kids can put them in the hospital every winter or spring, this time of year, basically. The hospital usually has several kids with RSV in there getting oxygen. No RSV cases this year at Christus. That's what I heard anecdotally. Lots of good effects of that. You certainly don't want your little kid in the hospital. And so just the fact that we've been doing the social distancing, wearing masks, being careful, we want to get back to gathering together, but we want to do it safely and we want to do it when we're all vaccinated. So let's work hard to get to that point.
All right. Dr. Johnson, any last words of wisdom?
Well, I think we're on the right path. We just have to keep going. And again, for that, I think we're now at the 20 or 30 or 40% of the population that's a little bit not really knowing what to do about the vaccine, hearing a lot of misinformation out there, questioning what's right and what's wrong. So just again, for that group, if that's you and you're not really sure, or maybe you think this one's better than that one, I want to wait for this one, please talk to somebody in the medical system, somebody who's informed about everything. Somebody can help you separate out the misinformation from the good information and see if you can get your questions answered.
Great. Thank you, Dr. Johnson.
All right. We'll see you next week.
See you next week. It's always good to see our own Dr. Fauci right here. Thank you.
Bye-bye.
So, good advice from Dr. Johnson. Just keep doing what we're doing. Wear a mask, stay safe, register at DOH. A few things to bring to your attention. Couple of pieces of really good news. Santa Fe joined the Built for Zero movement a couple of years ago to try to eliminate homelessness in Santa Fe. There are about 15 communities around the United States of America that are part of the Built for Zero coalition, where there is functional zero in homelessness. Well, 2 days ago, we learned that our friends at Built for Zero, which is Built for Zero is the program run by Community Solutions. The Community Solutions folks were just awarded $100 million from the MacArthur Foundation to end chronic homelessness in America in the cities that are members of the coalition. It so happened that the CFO, the Chief Financial Officer of Community Solutions, was here in Santa Fe on a vacation. We got together, we had a little celebration. He now has $100 million to figure out how to end chronic homelessness, and Santa Fe is very much on his map and on his mind. We're proud to be a part of the coalition. We are excited for the leadership at Built for Zero. Roseanne Haggerty and her team are outstanding examples of how to make social change happen in a systemic way. So congratulations to Community Solutions. Congratulations to Built for Zero. We are part of that coalition, and we will be eagerly awaiting ways that we can work with Built for Zero to take some of that money and leverage it here in Santa Fe. Maybe do another project like the Santa Fe Suites project, certainly find ways to do more outreach and continue to implement the Built for Zero methodology to eliminate homelessness. Something else that's exciting, I really want to rally the troops here in Santa Fe. We are competing in the National Mayor's Challenge for Water Conservation. We finished 4th last year in our population category. We want to win it all. We want to be number one. If you want to help, and I hope you will help, we all care about water in Santa Fe. It's a part of how we live. It is our water is life mindset. Go to mywaterpledge.com, mywaterpledge.com. Takes about 5 minutes to fill out a brief questionnaire about things you're willing to do to save water. If we get the highest participation of any city of our size in America, we will be number one. We will get some lucky nonprofit right here in Santa Fe will win a 2021 Toyota Highlander Hybrid. So let's be in it to win it. Go to mywaterpledge.com and please take the pledge. Another exciting thing going on, Will Schuster's Zozobra, our friends getting ready for the 97th burning of Will Schuster's Zozobra. There is a competition to design the official poster or the official t-shirt, either one or both. Artwork must be done, must be submitted by April the 30th. So please go to the burnzazobra.com website and submit your image, either for the poster or the t-shirt. It's great fun. It's part of Santa Fe. It is who we are. The burning last year was virtual and more people saw it than ever. It was global. We had people watching it from all over the world. This year we hope to have a hybrid event, some virtual, some in person, but the poster and the t-shirt are important ways to have some fun. Keep Santa Fe beautiful. Saturday, April the 17th, 9 to 12, we are going to do a Santa Fe litter collection. You can register in advance, pick up your bag, your t-shirt, your gloves, other gear at 1142 Siler Road, Building A. You can do it tomorrow. You can do it Thursday the 15th or Friday the 16th between 10 and 2. Go pick up those gloves, the bags, the t-shirt, and join with your neighbors to clean up the litter in our community. We want to be sparkling for spring. We want to spruce up Santa Fe. We've got city workers who are out doing it right now, working in the medians, working in the parks, working to do cleanup. We are going to spruce up Santa Fe. It can be a community-wide event, part of a spring cleaning, a coming out party after COVID. Let's make Santa Fe sparkle and keep Santa Fe beautiful. Let's see, we have some other great news. Prep for fire season. There was an editorial in the paper that this is going to be a dangerous fire season. We know there's a drought. We know it's dry out there, and we know that there is more likelihood for climate change provoked events. If you want to prep for the fire season, get a hold of our fire department. They've got a great group of people who will come out to your neighborhood or your house personally. Take a look at where you have cleared brush or should clear brush away from your home. Get your whole neighborhood together to take on a fire prevention and fire safety program. It's free of charge, and it can be done at the neighborhood level. It can be done at the individual level. There's also good news about calming on the plaza. We'll have police there, pedal bike back in May, but in the meantime, be respectful of everybody. If you've got a car that's loud and it's really fun for you to drive a loud car, take it out somewhere in the county and take it for a spin, but inside the city and certainly in our neighborhoods where people are trying to have quiet and peace and enjoy the beautiful spring weather, let's not have a noise problem this spring. Shop local. SantaFeMarketplace.com is an important part of supporting our local merchants. SantaFeMarketplace.com lets you go online to do your shopping, but do it local. Keep your money where your home is. There is a food distribution tomorrow, 8 to 10 a.m., Santa Fe Place Mall. Our friends at Santa Fe Place Mall continue to be good community members, making the site available for the Food Depot food distribution tomorrow, 8 to 10. A very important way to help you, yourself, and the community. If you have enough food, make a contribution to the Food Depot. Send them a check, send them a credit card, do it on the web, but let's keep everybody fed in Santa Fe. Governing body activities. So we just finished a week where there were two special meetings looking at the Zia Station proposal for infill housing and mixed-use development. There was a public hearing earlier this week where a lot of voices were heard. 27, 30 people were opposed or had concerns about the development. Another 15 to 20 people supported it. The council members were attentive, took notes, and then sent their questions to our staff and to the developer. Last night, there was about a 6-hour deliberation going question by question over traffic issues, affordable housing issues, questions of stabilizing an arroyo near the development, questions about the impact on the adjacent neighborhoods, questions about the impact on the view corridor. All of that was discussed at great length, including the amount of community input that helped to shape and improve the development. People who did not like the development, nevertheless, by their comments and concerns, made it a better proposal. They made it a lower proposal. They made the design reflect community values. I think we're all concerned that as Santa Fe grows, we will potentially risk the things we love about Santa Fe. We heard it recently with regard to our street light replacement plan. Yes, let's have street lights that are more inexpensive to operate, more energy efficient to operate, that are easier to replace and maintain, that can be dimmed at night. But let's not implement a street light plan that loses the essential look and feel of Santa Fe. Same applies to a project like Zia Station or anything else we do going forward as we begin the process of meeting our demand for housing. Our housing crisis is something we're all aware of. The effective vacancy rate for rentals in Santa Fe is effectively zero. It's so low that there's so little turnover, a unit never stays vacant for long. We know there is a deep, deep need for affordable housing. We know there is a need for all kinds of options for young people who may not be ready to buy a house, but would like to rent an apartment. So as we grow, the question becomes, how do we not lose the essence of our city? How do we not lose the soul of our city while we grow? And so all of these issues of infill, of traffic, of sustainability in a development, they all have to be given careful and deep consideration. And that's what the council did last night, literally until 1 a.m. There's also in our budget that we'll be talking about all next week, and I'll bring you up to date on that in a second. We've put money in the budget for a growth management study to address exactly this issue. Growth is going to be part of Santa Fe's future. We are not going to be able to stop growth. And frankly, we don't want to stop growth if we want our kids to be able to live here. We need to have more housing, more options, more jobs, more parks, more recreation for young people who want to start a family right here in Santa Fe. We're an attractive and beautiful place to live, a special place to live. That makes us attractive to all of us here. It also means we want our kids and grandkids to be able to stay here. For that to happen, we have to have some kind of growth. So no growth isn't an option. Unlimited growth would be horrible. It would destroy the fabric and the essence of our community. So how do we balance the trade-offs of growth with livability, with more housing, but not the wrong kind of housing in the wrong place? That's what a growth management study will give us, answers to those trade-offs. It'll be a community-wide conversation led by our land use department. The money is in the budget. It's an important and essential discussion for everyone to participate in, for everybody to have their voices heard and really to shape the future of Santa Fe. That is what is in the budget for next year. And so let me talk for next year. Let me talk about how we're going to take that up. Next week, we begin budget hearings. They're public. They are in front of the Finance Committee, but every member of the governing body is invited to participate. It is a budget that will be attempting to bring city government back to where it was before COVID. COVID was a crushing blow on the city budget because of our decrease in revenues. Now with huge federal expenditures, the $1.9 trillion that President Biden recently signed into law means there's more money across the nation. At the same time, we're seeing a recovery that's a lot stronger than we thought we would see, in large part because of you, because of your wearing a face mask, because of your getting us into the right color, making us turquoise, lets us open, be safe, live the Santa Fe promise. That opening is bringing back revenues. So the budget will be up for discussion next week, starting with hearings, and we want you to participate. The first hearing is Tuesday at 1 o'clock. Please tune in and listen. We are very pleased that when we had a public hearing on the budget in front of a meeting of the governing body, we had over 50 people participating, talking about affordable housing, talking about the need for positions to be added in key areas of city government, really addressing some of the key priorities for city government to beef up our resources, beef up our personnel, add people, add positions, add programs. So the budget will be coming out over the weekend. It'll be, hearings will be beginning on Monday, Tuesday, and on Tuesday, Wednesday, and Thursday, not Monday, Tuesday, Wednesday, and Thursday at 1 o'clock. There's also a Wednesday regular meeting of the city council at 4 and 6. So the government, your government, is hard at work. There was an exciting event today, as I mentioned, with Dr. Johnson, a community vaccination at the Midtown campus. There were 2,000 vaccinations for the people of Santa Fe. Very exciting step change in our response to COVID. A community event with terrific cooperation, terrific collaboration. Christus, the city, the county, the National Guard, across the board, joining hands to really make Santa Fe safe. So as we head into a beautiful weekend, please enjoy yourself, enjoy the outdoors, enjoy all the glory of Santa Fe in the spring, but remember to stay safe. Remember to wear your face mask, like Dr. Johnson said. If you see somebody who's not, politely say, we have a face mask ordinance here in Santa Fe. We want to stay safe. Please wear your face mask. Please practice smart physical distancing. In the meantime, we are in the turquoise, so shop local. Keep your money where your home is. Go to your favorite restaurant. Take part in a bowling alley activity. Go to see if you can make a reservation to Meow Wolf. Have some fun. Have some fun, but don't let down your guard. And take care of your family. Take care of yourself. Let's all take care of Santa Fe. Until I see you next week, stay safe, and I will see you after the weekend. Take care, everybody.